You know, it's really fun when you see somebody years down the road. You know, Mike Bauman's here. He went to high school with my brother and was really helpful for him. So I'm really appreciative of all the relationships, and that's why we're here, right? To learn and also to continue to build. So I got an email recently at the company website, and it was from a woman upstate New York, and said, my husband's on vacation and had a reaction from his blood pressure medication. He went to one of your clients and took 7 flowers, and within 1 hour, he was back on the beach. Right? That's powerful, right? So I can give you all the features of 7 flowers, but that story right there is powerful, that it's helped so many people with blood pressure, not only for that, but also eye pressure, stress, and a side effect of the medications. And Dr. Weiner has worked with the 7 Flowers product for, I guess, 20 years plus now with fantastic results. So I says, well, who's the doctor, right? So I says, wow, where were you? Well, we were outside. I said, it has to be Dr. Mike Epitropoulos. She goes, well, I don't know the name, but I'll find out. And lo and behold, when she emailed me back, she set up an account. She was actually an herbalist. That's the other part of the story. So Dr. Mike, you know, meeting a guy that had side effect with a medication, quickly uses 7 Flowers, helped him. His wife is a herbalist. Now she's a new account and singing raves about nutritional frontiers. So Dr. Mike is a trained chiropractor. He's one of the leading pioneers in applied kinesiology for the last 30 plus years. He also has a PhD in nutrition, CCN, and it's one of those names with alphabet soup. Epitropoulos is a long name, and then it's even longer, all the disciplines he has afterwards. He's going to specialize today talking about some really new technology, not only the microcurrent, but the new technology he's going to show you today. It's absolutely fantastic. So let's give a nice warm welcome for Dr. Mike Epitropoulos.
Dr. Weiner's afraid that I won't be heard, but I'm Greek, so I'm very loud, and I use my hands, and I'll keep everybody awake that way. It's a pleasure to be here with Dr. Weiner and Jamie. We go back a long time. I've been utilizing Nutritional Frontier products from day one, and I want to share with you what I call clinical pearls that I've developed over the years with Nutritional Frontiers protocol. And you're welcome to email me at any time if you have a case that you're having trouble with, or want to find out what I found to be the best combination of Nutritional Frontier protocol for whatever imaginable situation you're seeing in your offices. Don't hesitate to email me. I will give you my email address. It's healing, Healing, healing physician, of course, PHYSICIAN at AOL.com. I offered to Jamie that Dr. Streeter, who you're really going to love and enjoy this afternoon, he and I work together. We've been working together for 25 years. Dr. Streeter is an osteopathic physician, and he and I are putting together some books that we're going to have out in ebook form. If you give us your email address, send it to care of me. We'll send out to you, we're going to put out something called Clinical Pearls on a weekly basis that we'll email you to you. There'll be like case studies using Nutritional Frontiers formulations, and combination with Microcurrent that I'm about to talk to you about this morning. And just like Jamie said, we want to give you tools that you can use, number one, to help your patients. You all are the doctors of today and the future, because obviously the medical system is not getting the job done. And you are the only ones that folks can have hope. You give them hope. So we want to give you today tools, which, by the way, Frontiers is a cutting-edge company, because they're the only company that I can tell you, and I've been practicing now 34 years, which is amazing because I'm only 45. They are the only company I have seen through the years, and I've done them all. I've worked with Biotics, I've worked with Standard Process, I've worked with some awesome companies as well, but Frontiers is a cut above because they give you wonderful support. Today is an example. They give you wonderful educational materials, which I can tell you folks, use these educational materials that they give you. They're great marketing tools, I promise you. Just hand a patient, what I do once a week is I have a supplement of the week, or situation of the week, whatever, and I hand my patients once a week one of those solution booklets. I can't even keep them in my, Kim will tell you, I can't even keep them in my reception room. People just pick them up. That's one of the greatest marketing tools ever, okay? So because they'll come into your room once they've been in your reception room and say, well, what about this candidíasis solutions? Or what about this blood sugar solutions? So these are marvelous tools that you can use to help your patients. So what we want to do today along that same theme is what I'm going to do today is give you some information on a technology and an assessment program I put together that is going to be a little wellness center within your wellness center. And it's going to help you assess when that patient comes in to see you, when you take that case history, within 5 minutes, I can show you how to assess to find out what body systems are out of balance or involved by assessing hot spots. We call acupressure points. And then we're going to use a technology called microcurrent to then treat those system imbalances. And then I'm going to help you correlate exactly what nutritional frontier protocol you should have them on right out of the gate, okay? So today we're going to discuss this technology, and this is a way, again, another tool in a toolbox to help you, the one that they're coming to because everyone else is failing them, to assess and help them and to educate them. And then you know what they do? They go out and they bring you another new patient. We get 5 new patients every 2 days, and we don't have any advertisement. We solely just give them educational materials from Frontier, and we let it go from there. And it's awesome. Can everybody hear me okay? Perfect, okay. So my goal today in discussing microcurrent therapy with you is to, first of all, explain to you what is microcurrent. Show of hands, how many have heard of microcurrent? Good. Well, see, this is good because this is become a well-known science. But what I'm about to teach you is a unique way of using the microcurrent on a couple of applications. First of all, we're going to look at the technology just for a minute, an overview. Nutritional Frontiers has available to you the Mighty Mini device, which is the microcurrent device that we have, that, by the way, was developed by a pioneer in microcurrent. Anybody has ever heard of John Milovich? Familiar with Dr. John Milovich? John Milovich is a very dear friend of mine. He was one of the first to bring microcurrent into the United States from overseas. It's a technology that's been around for a long time, and let's see what we're talking about here. Candace, what button am I hitting again? The down arrow. Okay, you can all see that I'm not going to quit my day job. So here's a great tool right out of the gate that you all could use. I put this, we have this as Nutritional Frontiers can give you a copy of this. Stick this right in your reception room, right in your reception room. I have it right on my counter. And we don't have a day go by that a patient doesn't say, well, what is this Mighty Mini? Because I'm going to teach you how to market it to your patients. They should have one. Every single one of your patients should have a Mighty Mini. And I'm going to show you how you can show them how to use them at home to improve their health, to do some significant things. But this is a great marketing tool, but you can see the multiple application of the Mighty Mini. Multiple methods of treatment. Now, I spoke of John Milovich. That's not John Milovich. This is John Milovich's background, just so that you can see this is somebody who's been in the field of microcurrent technology for a very long time. This is his bio. I wanted to show this to you so you'll know that this tool is the real McCoy microcurrent, because there are some knockoff microcurrent out there, just like there's knockoffs on so many things out there. So this is the real microcurrent technology. What John did in this little device here, have you all seen this? You know, everybody used to come to us and say, gosh, I wish you all would develop a handheld microcurrent device, because the bigger units, as you know, are very expensive, run into several thousand of dollars. So what John did is he took the most healing of the microcurrent frequencies and he put it into this unit, okay? So we're going to talk about this unit in just a second. But basically, when we talk about microcurrent, why is electricity so important? It's the basis of everything, right? The body is electrical. And every living cell is electrical, right? So our whole practice is energy medicine. If you think about it as chiropractors, as naturopath, as medical osteopathic, we are harnessing the body's energetic value levels on a cellular level. And it's a matter of maintaining the energetic levels of the body. Every cell, organ, and tissue has a resonance, has a frequency. Show of hands in here. Who has heard of the Rife technology? Okay? And you know that this man was way ahead of his time and, of course, paid a price for it. But speaking of paying a price, are you all familiar with now, all of us that are natural medicine or natural healthcare doctors, we are on a hit list? Did you know that? There's 12 physicians that have been assassinated so far. Did you know that? Yeah. 14? I'm not kidding. I'm honest to God being honest with you. Most of them are in Florida. Two of them were my close friends. There was no explanation to these 14 people, that physicians, health doctors, natural health doctors, several of them medical, that are doing natural medicine. In fact, what they're finding, the commonality, in fact, if you want to read up on this, go to a patient of mine has a site called Health Nut News, healthnutnews.com. Aaron is Dr. Joe Mercolo, a friend of mine. Dr. Joe lives in Ormond Beach where I practice, and his fiance, who's a friend of mine, a patient of mine, that's her website. She has about 250,000 followers on Facebook. She talks about these mysterious murders, deaths. So the point of it is that, we've got all this great information, and we have to be careful how we share it. So it's just an aside. But the point of it is that Dr. Rife was an example back then. He was assassinated because he was ahead of his time with energetic work that he was doing. In fact, if you read up on, who's read up on him in here? As you know, the history behind him, he was going to do, he had developed this frequency energy machine, the Rife machine, which is actually the forerunner of microcurrent. And he was the first one to find that there's a signature energetic value, resonance, frequency for cell, organ, and tissue in the body. And he developed this device to bring that all into balance, because he defined disease as a disruption in that frequency, in that energetics, if you will. So this machine was reversing cancer. And he was going to work with the University of Michigan with 16 patients that were 3 months to live. And he's reversed them. And they were going to publish his findings. And all of a sudden, he disappeared. And so, in his place, his manufacturing plant was burnt to the ground. So, it's this whole process of suppressing information, but that's why it behooves you all to get the information out to your patients to help them. So through microcurrent and through balancing the electromagnetic resonance and frequencies of the cells, we're going to make some major health changes for that patient using the microcurrent, because it accomplishes that. Let's see. And of course, this is further explanation of the, it takes polarity, as we call the cell gradient transport, for positive, negative, for penetration of the nutrients, and also other processes that occur. Even the basic of how we came into being through the whole process of fertilization is an energetic. The sperm is positive, the egg is negative. So it all comes down to electricity. Everything has a frequency. Everything in the universe has a specific frequency. So with that said, we move on. The Germans were the first actually to do this work. And by the way, this is just a picture of the Mighty Mini. And just kind of, it's hard to read, but you all have the handout so you can read the print. But basically, it's easy to use, it's portable, it's convenient. I was just talking to one of the practitioners earlier. She uses it with her kids. The wonderful part of this, again, we send the patient home with it, and it's so easy to use for them, okay? And I'll show you how, again, you can school your patients. how to use it at home. Now, let's look at why is microcurrent so important? What is the therapeutics upside of this? Now, let's talk in terms of comparing it. And now this is taken from Clinical Orthopedics in 1986, but there are more current clinical referenced, journal referenced articles, if you like, email me, that show what I'm telling you. The basic facts is this. When we look at microamp, which is MENS, which is microcurrent, is microamp, but everything else that we use in our life, the lights, the appliances, tens units, is milliamp, right? Well, what's the difference? There's a very significant difference clinically. Now, yes, tens gives you relief with muscle spasming and therapeutic applications of that for those that are physical therapists and whatnot. That's absolutely true. But if we break this down to which more importantly, a cellular level, when we look at milliamp and microamp, the point is there's something called ATP. Tell me, who in here can tell me what ATP is? Let's see who's awake this morning. I told you I'd keep you awake. Dr. Weiner, of course. Adenosine triphosphate. And what's the significance of that, Dr. Weiner?
That's the energy molecule.
Energy molecule. Bingo, energy molecule. And that, what happens as we age, that battery pack, like everything else, of course, nobody in here is over 40, but the point of it is that energy pack starts wearing out. We start losing, the ATP starts to diminish, the production, and we begin to see the degenerative process. Well, guess when we use microcurrent, we increase ATP production by 500%. I'm not making these numbers up. These are studies. When you use tens milliamperage, and that's why they also say it's so dangerous with cell phones and appliances and computers and all, you're diminishing ATP by 50%. So which would you rather do? Increase your ATP or decrease it? Let's go back to where I was here. Hold on. Okay, that's one thing. But then the second thing is cell membrane transport, the ability for the nutrients to get in your cells. That's critical. What you're eating, the supplementation you're taking, you've got to get it into the cell. Gradient transport has to be there. When you use a microcurrent, you're increasing that transport by 30 to 40%. When you use MENS milliamp, which is a higher frequency, it decreases it by 30 to 40%. And finally, protein synthesis. You increase by 73% with microcurrent and decrease by 50% with milliamps. Yes?
Is MENS the same frequency they use in orthopedics to promote bone growth?
Yes, exactly. Absolutely. The question with bone growth is exactly what they use as microcurrent. Yes, it is. This is a great, by the way, this is a great tool, an educational tool for your patients to explain to them why the microcurrent is so beneficial. And some other things, oops, there we go. I wanted to show you some other things with microcurrent. Fibroblastic activation, that's healing, right? Cellular healing increases. DNA synthesis, you're affecting DNA synthesis with microcurrent. T lymphocyte activation, why is that important? That's your immune system. And what is the number one thing that everybody's walking around with today is a very low, fatigued immune system. You work with that all day long. We'll show you some other things you'll be working with all day long and what to do with it with microcurrent and the nutritional frontiers. Insulin binding, you're affecting glucose levels. This is great for diabetics, as well as calcium channel opening. It acts as an anti-inflammatory, the use of microcurrent. Okay. Now, here's what we've done. And I'm going to demonstrate, and I know I'm going to move around pretty quickly here, so again, nobody can fall asleep. I might just walk right up to you and wake you up if you are. Now, what we did, Mike, I think Michael, raise your hand back there. Didn't you put this chart together? Yes, you did. Very good job. So what we want to do is show you visually how you're going to start assessing your patients, okay? And I've retooled this approach because now we have two tools in the toolbox. And I'm telling you, with these two tools and a case history, you can figure out, you're going to assess hotspots, you're going to correlate the hotspots with the Nutritional Frontiers protocol, and you're going to treat with the Mighty Mini, and you've got a wellness approach that is next to none. And then I'm going to show you a DVD that a CD DVD we've developed that shows you some really neat things you can do. Now, everybody hold up your hand. Okay, now, put it against that, just kind of so, okay, ready? Now we're going to do basic 101 acupressure today. These points that are on your fingers and feet are what they call master points. Think of an electrical wire that starts at your fingertip and runs the whole length of your body to your toe. Those are meridians, energy channels, and we're assessing where the blockages are, what energy channels are blocked, and what they correspond to specific organs, okay? Now, take a look at your thumb. Go to the outside of the thumb. You see that lymph? Just push into that. Some of you might feel soreness. Anybody in here feel it? It's a little bit tender? That is if you are not working with lymphatic congestion with your patients, you're missing the boat. I can tell you right now, I can't even keep lymphatic tincture on my shelf. Everybody is on lymphatic tincture, and we'll talk about other lymphatic formulations from Frontier, but your lymphatics, everybody's going to have congested lymphatics, no exception. Who out here can tell me you have a patient walk in your office that doesn't have arthritis pain or muscle pain or joint pain? Anybody have lucky enough to have patients come to you that complain of no pain? I mean, what's the number one thing patients come to you complaining of? Pain, right? So the point is, if you want to really get after the source of their pain, number one, get after their lymphatics. Now, watch this. This is my pointer pal, it's called. And Jamie will be giving you information on how to get a hold of this. Now, what this simply is an assessment tool. And watch what happens. I'm going to go onto my lymphatic. Did you think that I have lymphatic congestion? Okay. You'll be pushing this on lymphatic points all day long, and if you get somebody that doesn't ring high like this, you've got somebody who's really from another planet because they're doing really well with their lymphatics. I would then ask, well, exactly where did you come from? True story. When I practiced in Kalamazoo, Michigan, Dr. Streeter and I were in the same town. We practiced together back 20 years ago when I was only 20 or you were 20. I lived my practice was 3 doors down from the state mental institution. So patients they would leave. They would just walk out and they would lose them for the day. So one morning I walked into my treatment room and this young man was sitting there. He was my first patient of the day. And he says to me, "I'm really sorry, Dr. Mike. I am so sorry because I'm running late because I'm coming from a very long distance." I said, "Well, where do you live?" He goes, "I live on the sun." Go to my phone, hello? Call the institution. I think somebody left yesterday. They're in my office today. Okay. Now, actually, that was most of my patient load. Next point. Push on your lung point. Okay. Now, what we're doing, if you heard how high assessment that was, right? Did everybody Kim, can we give them that handout for the hand? Kim is going to give you a handout. It's going to have it's going to have this on it, and you're going to turn onto the back of it, okay? Frontiers will provide you with this. It's going to be like a kit. And what you're going to do is if you were assessing a patient, right, and you had that sound on lymphatic, okay, and if you had to grade that from 0 to 10, what would you call that? What intensity would you give it? 10. Would you give it a 10, right? Yes. Okay, so we'll give that a 10. So right under the organ system where it says lymph, you're going to put intensity scale 10. Or your your assistant. I would even train an assistant to do this, because I'm going to show you now how you can do this in your office, and what to charge for it, how frequently to do it, and then you're sending them home with the Mighty Mini. You're going to be treating them in the Mighty Mini with it, okay? So let's write a 10. We would write a 10 there. Now, let's go to the next point. That's lung. That's not as high. What would you say that is, Doc? Would you give that a grade? 5? Anybody? Did you hear that? It's lower than the other one, right? So I would give that a lower score. Are you with me? Yes, yes.
What's the scale? I mean, is there a sound scale?
That's high pitch is as high as it's going to get with the lymphatic.
So then a 1 intensity would be no sound?
No sound, exactly. So very good question. James was asking about the intensity scale, 10 being like this, and then 1 being no sound, okay? Now this one here, go to your point on your lung, you see that? That's about a 5 or 6. Now, everybody, another hot spot, everybody will be working on this all day long, okay? Go to your index finger. See where that spot is? It says colon. Rub that point, just touch on it. Anybody sore there? You're sore. Anybody else? Okay, now, Jim, okay. So we got the index finger here, right? We're going to go out the side of it. That's colon. What does that mean? That means he's got candidiasis and parasite, virus and bacteria. Microbial issues. Microbial issues. You're going to find this all day long, folks. They all have, if they've got any health problems, they're going to have congested lymphatics and they're going to have microbial issues. You've got to work on those areas. Okay, and what does that mean? What would you do with frontier formulation? Here's what I do in finding that if I just found the lymphatic and colon on someone, I would put them on the lymphatic tincture at 3 dropperfuls a day. And then with the colon being as hot and active as it is, I'd be utilizing Candy Kill 3 a day, lymphatic tincture, a Microcurrent 3 dropperfuls a day. The new formulation that Jamie just introduced me to, the SBC formula, Mike Gallagher, is that what it's called? What is it called? The one that SBC2, okay, beyond that as well, at least 3 or 4 of those a day. And does everybody in here have a practitioner's notebook, access to one? You need to be utilizing those food plans. Who in here has one of those practitioner's notebooks? Okay. Training manual, training manual. You need to be utilizing those diets in there. I hand out all day long the Candidiasis food plan, Candida's food plan. Use it. Give it out as a handout. Your patients need to be on a Candida's food plan. Can anybody tell me what kind of food plan that is? What would you be eating and what would you not be eating? Anybody? What would be a no-no? What would be a no-no? Okay, what else? What else? How about dairy products? No dairy. No dairy. Okay. This is a beautiful handout, okay, food plan they have, and then they have another one I love to use. I use the one for gluten-free, So, but the point is, candidiasis, you're going to be working with patients all day long, so we've assessed them. So let's say what I like to do is not assess more than work on 2 areas, and I'll show you in just a minute how to use the Mighty Me to do that. So, on the back of that, did everybody get one of these finally? Good. So far we've done the lymphatic, that rated high. So on the back here, your assistant with intensity score would be 10. Date it, okay? And then the next one over, which is a higher, I did my lungs, and the lungs were about a 5, so I put a 5 for intensity score. The next one I did was colon, which is a 10 intensity score. What I'm going to tell you is I wouldn't go more than 2 or 3 things to treat. Let me go to the next one. Let's go to the next one. Circulation. That's another thing you guys should be working on all day long. Everybody walking around has bad circulation. Have you noticed have you heard more about people getting blood clots? Raise your hand. Do you think that hasn't been going on in the past? It's because everybody walking around has bad circulation. So, watch this. Including me. Doctors, we doctors are sicker than our patients, right? We don't take care of ourselves. Who in here, I mean, I can only think of one person. I'm sitting next to him back there, Dr. Streeter. This man is amazing. I see the stuff that he takes. He runs circles around me because he talks and walks the talk, okay? Because otherwise we're catastrophes looking for a place to happen, all of us, because we're so passionate about, right? We're so passionate about helping others, but how about us? Okay, so circulation. So we would then say, okay, that's a score of 10, 9, and then I would also include protocol. Let's talk about it. What do I use for circulation right out of the gate? Circucare. Circucare tinctures are amazing. Circucare extremities, Circucare head and heart, incredible. 3 dropperfuls of each a day. Okay, start out of the gate with at least those 2 tinctures for their circulation, okay? And we'll go into more of the product line in just a second. But here's a method, see, now, quickly, and by the way, we'll show you how to treat with this. Yes, Mike?
What do you flavor the tinctures with? That's huge challenge is this taste of tinctures.
Well, I had one patient tell me she flavored it. The question is, what do you flavor with? I had one patient tell me she flavored it with sangria. So she drank it 5 times a day. So that isn't what I'm recommending, though. That word got out really fast, and Dr. Mike says sangria and your tinctures, and you're all set. But no, all kidding aside, I'm hearing various things, Mike. Some people actually put it in their almond breeze. Others, I've heard it, here, great relief here. I hear it in putting some apple cider vinegar in there in some water and drinking it down. Apple cider vinegar masks a lot of stuff, basically. It really does. If for those of you who've ever done a peroxide cleanse, anybody ever use hydrogen peroxide, food grade, besides Dr. Streeter? We can talk about that in the subject another time, but apple cider vinegar will cut the worst taste possible, so that might be something they would try. Of course, then they have to get over the apple cider vinegar taste, but anyway. Iced tea. I personally use a tart black cherry juice as one, green tea as another, okay? I have patients that do it with water. Dr. Weiner, what do you suggest with those? Do you have any special formula?
They taste that bad.
You don't think they taste right?
When you're saying apple cider vinegar, I don't know that that's a good idea if you have candidiasis.
Well, there you go. Then scratch the apple cider vinegar. Just put it in something that is going to give you some cut in the taste. But like Dr. Weiner said, and I agree too, they don't taste that bad.
They can use the reds, purples.
There you go. Which, by the way, you should be having them on the greens, the lean greens. If they've got candidiasis, their colon is a mess, what should you be doing? You should have them be alkalizing, right? Alkalizing. There's nothing better to do that than the pro-lean greens. Okay? Now, adrenals. Who in here does not have tired adrenals? And you too are from another planet. Adrenals, why? Who in here doesn't have any stress? Please raise your hand and I will give you $100. And my second question is, what kind of practice do you run? Okay, you can always tell by the intensity of adrenal blockage how intense the patient is. That's me. But I've been working on my adrenals, but they're still pretty fatigued. Hear it? Pretty high. Dr. Weiner, let's see how intense you are.
Stressed out.
Jamie, go light on this guy, lighten up. Poor guy. There you go. See, but do you see what I mean? We're all, as doctors, as practitioners, we got it going on with the adrenals. So we would rate him as what? He's a 10. 10 on a lot of levels, right? There you go. So we're going down the list. Okay, now, the pancreas. Who in this room does not see one patient that has blood sugar problems? Everybody, right? Everybody has blood sugar problems. Let's go to it. So find that knuckle. You see it on your 4th finger? Everybody there? Go to the side of it. Now I'm on a very heavy regimen of the Frontier product for my pancreas. And I can tell you right now what works wonders for me. I'm working on using Sugar Solve. Anybody ever try Sugar Solve in here? It's incredible. Okay, I use 2 twice a day. My thing is usually ringing off the hook. Let me see yours, Doc. Can I have your hand? Uh-huh. Well, here's a healthy doctor. Well, she's got thyroid problems. That's the next one. Okay. Let me see anybody with blood sugar here. Jeez. Okay, he's got pancreas issues. Okay, so he's got a high score on his. We need him on to be. You see the handout on sugar solutions? Grab that handout. You should hand it to your patient and say, I want you on this protocol that's in the sugar solutions, okay? But guess what? If we were to check him on his candidiasis, what do you think? Candidiasis. Do you see? Anybody tell me why would your blood sugar be off if you had candidiasis? Anybody? What about it?
Because it makes candida in your body, the sugar.
They're feeding the microbes. So it's a given that when you find candidiasis, microbial with that colon reflex, you're going to also be working on not just the candidiasis with them, but you're going to make sure that they're eating the handout that they have in the workbook is a blood glucose. Have you seen the glucose handout you have it back there, Mike? Yeah? The brochures is part of it, eating a glucose. Anybody tell me what when I say eating a low glycemic way of eating, what am I talking about? What do you tell your patients when you're telling them low glycemic? Tell me. No sugar, no what? No carbs, no what? What else? Corn syrup? Dr. Streeter's going to mention something to you today, but I bet you all didn't know that. You ever hear the medication Armour for the thyroid? What's in it, Dr. Streeter? What's in Armour? Corn syrup. Corn syrup. Plus pork. So corn syrup's in everything. But they've got to get rid of that stuff. Who in here is on a no-starch diet? Anybody? Raise up hands where you're not eating pasta, potato, bread. Anybody? Good. Feel better? What's that? Rice. Okay. Now, let's go next to the biggest one that you're going to find, and Dr. Streeter's going to talk about today. Go up from the knuckle, up on the 4th finger. We have, and I found it earlier on Doc here, it's the thyroid. Her thyroid is hot. She's got blockage to that meridian. Okay? Now, Dr. Streeter is going to be talking about thyroid today. But one of the first things we do with thyroid is we have them on iodine plus. We can't keep that on the shelf. Okay? So speaking of these correlations, by the way, there's points on the feet as well. So basically, are you getting the gist of how you're doing this? So here's what you're doing then. You're assessing each of these points, and you're grading them. You're only going to work on 3 points. And then you're going to go right back to them with the Mighty Mini. You turn it on by pushing this button. Are you with me? And you're going to take this, and what did we first map? The lymph, right? So for 30 seconds, twice a day on your patient, well, when they have this at home, you can use this. I'm going to skip all around here. Let me get to the part. Can you turn to your handout where, on your handout where I break it down into how to do it with your patient in terms of in your clinic? See if you get to that part. Okay, so underneath I said instruction. Basically what you're doing is you're going to treat your patient twice a week for 4 weeks in your office, and you're going to work those points that you've mapped out so far that are the hot spots: lymphatic, colon, which is the candidiasis, and adrenal and thyroid. Let's say 4 spots. So you're going to do 30-second application with this on. As long as that light is on, the microcurrent is being activated. You're going to hold it on the hot spot for 30 seconds. You're going to go from the lymph, then you're going to go to colon for 30 seconds, then you're going to go to adrenal for 30 seconds, and then you're going to go to thyroid for 30 seconds. Now, with this, you may or may not feel anything. Some will feel a pulsation, a prickling, pins and needles, pulse, something like that, or you may not feel anything at all. It doesn't matter whether you feel it or not. You are doing the therapy when this light is on. You always hold your finger on this strip. You got to make contact with that. How will you know that you're progressing with this, that it's making a difference? Because when you go back and assess the patient with a pointer pal, the intensity will be lower. You will start erasing those hot spots, if you will, and in conjunction with the fact that they'll be on the protocol. So here's what we have. We have a patient that's come in. We've assessed them with the pointer pal. We've written in the numbers on the areas that were hot. So we've got a 10 by lymph, an 8 by colon, let's say an 8 or 9 by adrenals, and a 10 by the thyroid. We've dated it. You're going to treat that patient that week twice. I usually do it 10 to 15 minutes and charge $20 for the treatment. You will treat them twice a week for 4 weeks. You also are putting them on the nutritional frontier protocol because it's they're lymphatic, they're on lymphatic tincture 3 dropperfuls a day. Because it's colon, they're going to take Candy Kill 3 a day, Microgon 3 dropperfuls a day, and the SBC probiotic, at least 2 to 3 of those a day. They're going to take, for their adrenals, they're going to take adrenal tincture, 3 dropperfuls a day, and the Adrenamax 2 twice a day. And for the thyroid, they're going to be on iodine plus. That's their protocol at the same time that you're doing the Mighty Mini treatment of those points. Are you with me? And what to charge and how to charge. And like I said, I'm charging about $20 a treatment. Now, after within 2 weeks to 4 weeks being into the treatment of them with a Mighty Mini, and you can have an assistant doing this in your office, I'm going to send them home with one of these at the end of about a month. Because at the end of 1 month, I'm going to do a reevaluation. What does the reevaluation mean? Well, I'm going to go back and take the assessment of those hot spots and grade them and compare them to the grading that I did on that first time. And let's say now the hot spots are grading out at 2 and 3, and they were 10 before. But at that evaluation at the end of 1 month, I'm now finding other hot spots. Let's say I get over to the pituitary pineal gland. Who in here works with the pituitary pineal gland and hypothalamus? Anybody? Here's a way you can find out if they have an involvement. Go right up that 4th finger. It's right above the thyroid. I've got some involvement of my pituitary pineal and hypothalamus. I'd grade that out. Now, it happened at the end of 4 weeks when I reevaluated that patient, me, and I found the other numbers down, but now I've got a high number on another area. Well, guess what I'm going to do now? Now I'm going to take the higher numbers at the end of 4 weeks and start working on those. Who in here is familiar with the peel the onion? What does that mean, Doc? Tell everybody. Peeling the onion. Tell them.
Peeling the onion is taking off different layers of issues from the body because you're able to keep going to the core. That's what we do in homeopathy.
There you go. Okay, did everybody hear that? So you've got to fix one thing to get to the next thing, right? Mm-hmm. That's the part. We have to keep remembering. We as practitioners are balancing body systems. Sometimes we get caught up in, we don't want to get too caught up in, I'm treating this symptom and that symptom with the nutritional supplementation as much as we want to identify body imbalances and then strengthen them so that we can peel that layer first, and that gets us to the next layer, okay? So for example, you might have a patient that came in to see you that initially presented with where you found a hot spot for the colon and the adrenals, and nothing else showed up as a high level reading. And then after a month, then you see that the readout on the colon, the hot spots are diminished and adrenal are diminished, but now her thyroid is high reading, high hot spot, very hot spot, and liver is a hot spot. So now you're to the next step, and you can follow a pattern this way. If you look at the handout, let's look at correlations. So I know I'm jumping back and forth. There's a page on there that shows, here it is, Nutritional Frontiers, Supplements to Support the Organ System in Conjunction with Activating the Acupressure Points with the Mighty Mini. Is everybody on that part? That is page 25. Page 25 is Nutritional Frontiers Supplements to correlate with the acupressure points. Are you all there? I wanted you to go there because I wanted you to, here's the deal. When I tell you, when we get a hot spot, in other words, once we've identified that acupressure point, for example, lymphatic, you should have them on. What I like from that group right out of the gate is I use the proline greens and lymphatic tincture combination is wonderful for the lymphatics, okay? I mean, right out of the gate, I go with that, okay? So you want to have them on the lymphatic. How many in here use the tinctures? Raise your hand. How many in here? If you're not using the tinctures, you're missing the boat. If you're not using the tinctures in conjunction with the other nutritional frontier supplementation, you're missing the boat, because I'm going to tell you something. The tinctures do some amazing things because they're working on a cellular level. They're alkalizing and detoxifying. And the lymphatic tincture is going to do that, and you need to use that all day long. Just like, for example, on the colon, I mentioned the fact that I would go, when I found that as a hot spot, I would go with Candy Kill and Microcurrent, because that what I have found to be, right out of the gate, a great combination. But you have those other things you can use as well, okay? We're just trying to point you in the right direction, because now you have a tool that is going to give you a correlation. So in other words, you're going to assess and find a hot spot, and then you're going to correlate it with the nutritional frontier supplementation along with a case history that you've taken. And this is a quick way to really get them going. And it's a wonderful way also, if you think about it, to move product. Because patients, and especially if you have them doing the Mighty Mini, as you're doing the Mighty Mini, they're going to get results. And what do patients that get results do? They're happy. And what do? They're the best referral system in the world. Okay? And what they do is they say, gosh, you got to go to that doctor's office because I'm feeling better fast, because this doctor has got me doing this microcurrent therapy, and he's got me or she's got me on a specific nutritional frontier protocol. And this little instrument here, this Mighty Mini, you may not think that it's doing anything, but trust me, when you use it on a regular basis, you get some really interesting clinical results. It will blow your mind, because microcurrent, the impact, as I mentioned, it has on ATP and cell gradient transport and protein synthesis and fibroblastic activity and DNA synthesis and T lymphocyte activity. You're working on a cellular level. And those of you that are pain doctors, I know there's some doctors in here that focus on pain. Well, we all are in the same boat, because if you're working on those points, if you're working on decongesting the lymphatics, and you're working on the adrenals, and you're working on candidiasis, you're going to get rid of their pain. Instead of putting them on, what's that popular drug on TV that starts with an H and ends in an A for arthritis? What?
Humira.
Okay, here's a Humira story. Patient comes to my office, amputee. What happened? Well, I have arthritis, rheumatoid, and they put me on Humira, and nobody monitored her CBCs to see how her immune system is doing. Because guess what the Humira does to the immune system? Depresses it significantly. Well, this lady had horrific increase in her lymphocyte, decrease in her neutrophil. She's out working in the garden, gets a scratch on her knee, amputation 2 weeks later on Humira. And guess what she still has? Pain. Now she has no lower leg. Whereas you, as a practitioner, would take this patient and say, would you think you would find lymphatic congestion with her? Would you guess? What else do you think you'd find with her? Anybody? Circulation, whatever. What else? What else? How about candidiasis? How about virus, bacteria, parasite, yeast? How about that? Simply by then getting this patient on a program with the Frontier protocol of establishing her lymphatics, supporting them in the adrenals and the candidiasis, and then using the Mighty Mini, the microcurrent, I'm telling you, there's not one patient that is in pain that you're not going to take out of pain by doing this type of protocol. Now, mind you, Frontiers has some wonderful, like X-Flame, Jamie. X-Flame is great. HA Plus is great. I think it's been vegetarianized. You can support the pain, which, by the way, speaking of pain, do you see those X's on this person? Who in here does not work with low back pain? Raise your hand. Everybody, right? So here's what you would do. I've given you the spots now on the handout. For those of you who want to know what to do with pain issues, let's go to that page. You can do this through clothes. You can actually do this through their clothes. Wet the area. Let's say you can't do skin contact. Spray that area of, like, they would see that lower back X, those two, and just contact the clothes through the wet clothing. And you're putting microcurrent right in them. Okay? Now you can, anything that's X is where you want to contact. It's quick relief using Mighty Mini, using microcurrent, in conjunction with them being on the X-Flame and the HA Plus and the inflammation tincture. That combination, by the way, is wonderful in conjunction with treating those points. You're going to affect 99% of the people that come to you with pain patterns in conjunction with candidiasis work and adrenal work and thyroid work. Let's look at another X pattern for pain. Let's look at, and you're only contacting those points for 30 seconds. That's all you're doing. Okay, everybody, look, take your hand, go into the web. Right there. That's a master acupressure point. Okay, you see where I'm at? Rub in that. Is that tender? Okay, is that tender? You're going to take your Mighty Mini microcurrent and you're going to apply it for 30 seconds right in there. That's a master pain control point, by the way. Master pain control point. Some more points for the lower back. Now, how many in here work with patients that have asthma, that have respiratory problems? There's one point on the wrist. See where it is? Right a little bit before the wrist, you can contact that with the Mighty Mini. And in conjunction with the formulations that we have from Frontier, I mean, you have a lot of patients coming in with bronchial upper respiratory problems. You know, by the way, if somebody presented to your office with upper respiratory problems or asthma, can anybody tell me what is one of the first things you're going to look for? Who said that? Great. Candida. You're going to go after the candidiasis and those microbes. You're going to use the CandiKill and the microgon. Can anybody tell me what else that starts with an L that was on your first finger, thumb, that you would look at? Lymphatics. Their lymphatics are always congested. Always. Okay? So you would use the candidiasis, the CandiKill, the microgon, the lymphatic, and then you would use what is it, Air Max, Jamie, that you have for the lungs? And there's a whole list. In fact, if you look at that summary that I made for your lungs, you could implement those supplements from Frontier. What would you tell them to stop eating? Dairy. What else? Sugar. Poison, right? Let's look at some other points. Pituitary reflex, back of the skull. Did you know that if you go, everybody take your index finger and go to the base of your skull, the occipital shelf, and feel right there. That's a master meridian. Did you know if you took an ice cube and just laid that ice cube against there at the end of the day, you literally will see some major health changes start happening with you. Major. By taking an ice cube. Well, of course, you take the Mighty Mini and go right there at the end of the day too and do some amazing stuff, and you start to see, if you have your patients, if they did anything at home with their Mighty Mini just to take and stimulate the pituitary reflex, okay? And then you would be on, by the way, if you want to work with your pituitary gland, pineal and hypothalamus, has anybody in here ever used endocrine? The endocrine formula, the tincture from Frontiers? Anybody raise your hand? See, you're missing out. I'm telling you, you got to use that endocrine. It's incredible. You're going to see some clinical things start to happen with endocrine. Anxiety. There's a point for patients with anxiety. But what other glands would be off kilter causing anxiety? Anybody? Starts with an A. Adrenal. Okay? So you'd be working on their adrenal. Now, here's for lower back, hamstring, thigh. These are some, you folks, anybody in here work on sports injuries? Sports type? There's a great level of points that we show you for acupoints for all the different body areas, from ankle to Achilles, the back, the elbow. So these are points that you literally just activating for 30 seconds with a Mighty Mini. I would also recommend, in addition to using the Mighty Mini on those points, that you would have them on the inflammation tincture, okay? Inflammation and joint tincture, which is awesome. You know their adrenals are going to be fatigued as well. Some just thoughts on arthritis with the Frontier protocol. Now, let's summarize so far what, yes? What's the difference? Yeah. Well, you're massaging, you're getting a general momentary stimulation of that point.
Well, the diagram you showed, some were larger and some were smaller. Is that the one for hamstring?
Oh, yes. Those would be more major points to work on. Those are going to be very active points. I'll show you more specifically in a slide in a minute. So to summarize, so far, we've taken the pointer pal, we've taken the hand chart and foot chart, and we've assessed points on the hands and the feet. We grade them accordingly and write the date and grading. We then would treat with the Mighty Mini those points on the patient twice a week for the first month. At the end of the first month, and each time charge them $20. At the end of the month, we would do a reevaluation of those points with the pointer pal. We would then send the Mighty Mini home with the patient sometime in that first month. And what would you send them home with? You'd send them home with this hand and foot chart and circle for them the areas they're going to be working on. Okay? They work on the points on both hands or both feet. You have them on the specific nutritional Frontier protocol that you have them on. Okay? But you're able to change out that protocol at the end of the first month if you have to a little bit. But I try to keep everybody on a 90-day program. Okay? Now you do those twice a week treatments for 4 weeks, but then in the second and third month of that 90 days with Mighty Mini, you would be doing it once every 2 weeks. But they already by then have a Mighty Mini at home that they're using as well. But again, you're able to know specifically how to change out the Frontier protocol. Are you understanding what I'm saying? Okay, so to see if you're paying attention, let me give you a little quiz. Here's a case. I'm going to give you a case. 45-year-old presents in your office. She's complaining of extreme fatigue, She has multiple points of soreness in her muscles and joints, particularly in her neck and lower back. She's gaining weight. She's having brain fog, difficulty concentrating. Am I describing half this room? She's having trouble sleeping. Okay? Okay, so let's talk about this patient. Oh, digestive problems, very significant. Okay, bloating and such, elimination problems. Hair is falling out easily. Eyes are sensitive to sunlight. She has severe mood changes. Anybody tell me what are some of the things you're going to look for when you're assessing her with a pointer pal? What do you think is happening with this patient? Okay, thyroid. Okay, what else? Okay, what about the colon? Candidiasis. What else? Okay, what else? Okay, pituitary possibly. How about enzymes too, lacking enzymes? Why is her hair falling out? What's weak? Her thyroid, right? Okay. So you start putting this picture together, but you then are assessing her at the same time and confirming. You're going to correlate the assessment with what you're thinking, because you got to start thinking in terms of this is like a story. You're doing a story on this patient, yes?
So I had a question pertaining to children then, not going into protocols.
Yes.
But I noticed the pointer pal has 2 settings. Do you set those both the same as you would adults? And the treatment protocol with Mighty Mini, would it be longer, shorter duration?
Very good question. When you're assessing children, what you'll do, starting with a pointer pal, is you're going to turn it down to half of what you would do with the adult. The settings on this is what I was testing everybody on, is the setting is at about 9.5, 9 to 10 is the highest. With a child, it would be half that. As far as treating with the Mighty Mini, it's one setting, so it doesn't have a variation on that. But you would do the 30-second twice a day. But by the way, the more frequent you use it, the better. So the Mighty Mini, the convenience of it at home is that you're sitting watching TV, you're doing your points. It becomes habit. You have the patient do that. Yes, Jamie?
What about the dial on the Mighty Mini? Does that increase the frequency or make it different?
No. Well, actually, the Mighty Mini intensity, yes. The dial increases the intensity of the feeling, but they don't have to, again, it's not an intensity thing with the Mighty Mini, that they have to feel it. But some people like to want to feel, which, by the way, I'm glad Jamie brought it up. You don't necessarily have to feel anything with the Mighty Mini. You may not feel anything because you've already identified the hot spot with this, so we know we're working on a hot spot, and you're going to go back and reassess anyway. But some people may feel something. They may feel a pulsation. Does anybody in here have a Mighty Mini? Who in here feels something when you use it? What do you feel?
We felt a shock.
You feel shock? Who else? What else do you feel? A tingling. What else? Anything? Pulsation, vibration. Have you ever felt something in your finger when you're using it? Like you remember when you're going like this? By the way, when you do this on your patient, by the way, I forgot to mention this. Let me see your hand. I'm going to make contact with my hand. I'm a conduit. So I've got to touch her. So let's say she's got a pain in her right here. Then I'm going to go right in there, okay? Whereas if she's using it on herself or you're using it on yourself, you're just making sure always you've got contact there. But what I'm trying to get at is you don't have to feel necessarily. But if you feel something, what does that mean? It means it's a very active spot, a very active area. Now, we haven't gotten to the best part yet. You can use this for weight loss. Yes? Who? I'm sorry.
I had a client of mine try on some tendonitis in the outside.
Yes.
And she got dizzy.
She got
Sit
dizzy.
down, said she actually felt some of the tingling
Yes.
into her heart.
Yes.
Do you ever have people?
Yes. And it's a good question that is it Fred?
Fred.
Dr. Fred
It's
has.
just
Fred. He was working on somebody, and in fact, I was doing it with a Jamie today, and he said that he was working on tendonitis on their left elbow. And he hit an active meridian. Went to the heart. It was actually a reflex to the heart. Okay, when you feel it in other areas. I was working on his neck today, right up here, right, Jamie, or left side, Jamie. What did you feel? Into your toe, right? Well, Jamie was an example of where it's like a whole energetic pathway that you're stimulating, and it's going down that energetic pathway. So you may feel it in other areas. That is not at all unusual. Does anybody else experience that? Yes.
I was just wondering about you saying, as you're watching TV, you're doing
Yeah.
treatments. So when you're doing this to yourself,
Yes.
do you still recommend just staying with the 3 highest points, or can we just be there? Like,
You can do all kinds of
day long
points.
doing
I had a
that?
patient actually would do points all day long, and it's great results.
Okay, all right. I was just
Absolutely. Yes.
Are there any contraindications with like pacemakers?
Yes. Well, I wouldn't advise a person with a pacemaker to be using microcurrent anyway, any kind of electrical thing. Yes.
These areas with the general treatment for calf strains and shoulder
Yes.
strains and stuff, these points, are they specific acupuncture points or just general areas on the shoulder?
They're specific acupuncture points, and I'm going to show you in just a minute a really good overview of that. But yes, they are specific, yes.
contraindication for chemotherapy patients?
No. Actually, it would benefit them dramatically. Dramatically, yes.
What was the question?
Chemotherapy is not contraindicated. Yes.
When you're doing your initial testing, let's say a person has a lot of issues, more than 3
Yes.
or score 10.
Yes.
Which 3 do you choose?
The higher, I'm listening for that higher, even that little bit of a higher intensity sound. I'll go with those first 3. Now I'm marking them all down so I can go back to them. But the question was, if you've mapped out 6 points that are various intensity levels fairly high, you're going to try to go with what you feel are the highest. And yes, Jamie.
And are you trying to do a cleansing with the lymphatics?
Yes.
and the candida and
Yes.
other things, which would probably open up other areas?
Yes.
Maybe for round 2 or 3?
Exactly. And you can work on those secondary areas with some supplementation as well. But if you don't want to overload the patient with so much supplementation, at least I generally send my patients home with at least 4 or 5 different nutritional frontier supplements right out of the gate. Yes.
So then you were saying about having them on for like at least 90-day
Yes.
program.
Yes.
And if you give them like say 4 supplements or
Yes.
whatever, and then they come and reassess.
Yes.
Well, will you still keep them on those
Yes.
products that you
Yes.
had before,
Yes.
and then add more to
What I may do, and that's a great question. At the end of the first month evaluation, I'm still going to have my core program. So for example, the lymphatics graded out high, the colon graded out high for candidiasis, and the adrenals graded out high. And secondarily, less intense, I graded out the thyroid and I graded out circulation. So I'm going to have them on the lymphatic, Candikill, Microgon, SBC, and adrenal. But and then at the end of the month, I find that those numbers are down a little bit, but the thyroid now is even higher. Well, I'm going to add an iodine plus. I may cut my dosage down, let's say, on the adrenal tincture from 3 dropperfuls to 2, and I might cut my lymphatic down from 3 to 2. Do you see where I'm going with this? But now I'm going to bring in another one and bring up the optimum dose on that. You see how this works?
But
And
your body always kind of goes back to where it was.
exactly, exactly. But this is a beautiful way to monitor your patient. It's a tool to be able to know, first of all, to where to treat and to what frontier product formulations to include in their protocol, and to be able to do it just like that. The patient is going to be compliant. They're going to understand what you're trying to do. They're going to get the whole big picture, and you're going to see some great clinical results. And I can't emphasize, when you're doing this microcurrent, you may not think anything is happening, but if you do it consistently and have them doing it at home and matching it up with the Frontier protocol, you are going to get clinical results. I'm telling you, it's going to blow your mind. Yes?
With the pointer valve,
Yes.
how specific is that to find the right?
Good question.
What's your margin of error?
There's a large margin of error, large margin. Because if you look at the handout we're looking at, if you look at the fingers, for example, you're looking at the sides, for example, like, see, I'm going like right on this circulation here, or let's go adrenal. I get right in the general area of that nail bed on that 4th finger. on the outside. Anywhere in that general area, it's going to ring. That's the beauty of this.
Find the point?
I'm sorry?
If you move it, will it find?
It will find you. It'll help you find it. Watch this. I'll be out here. Okay, I'm in the middle. I'm not quite there yet. See? It will even help you guide you to it by the intensity. Okay? So it's not any form of being extremely right on the money. This is very, very helpful that way. Do you have any questions on how to assess points? Yes?
With the pointer, is there any way that instead of substituting the sound for numeric numbers so that we can actually be able to show the patient or ourselves what a true 8 is, or what a 9, what a 7 is, instead of it sounded like that? Because if all of a sudden, I'm assessing the patient and I got a little bit of a cold, I can't hear as well. So
Well, if you push this button, it's a light, yes, but watch this. Now you're going to tell them, hold on. What do you feel? What are you feeling? She's feeling a pinching. So you can push this button and they'll feel a pinching. You're putting a galvanic current through them at that point just to pick up on that, how hot spot that is. So in other words, what I'm trying to say is you don't have to depend on an audio. They're going to feel it.
okay. But is there any way, numerically, can that machine be altered in some way that we see it down, so that also the patients see it and we can see it? And it's
That's the instruments that run you about several $1,000s to be able to see that. In fact, I've been trying to come up with a machine that I use I can't even think of the thing right now, being able to read it on a readout, but that ties you up into some major expense. What we're trying to do is provide you with a very inexpensive but yet effective tool to assess and treat. Yes?
Home treatment, if you give patients do this at home,
Yes.
still just twice a week?
Every day.
Every day?
Yeah, once you get them using it at home, I would tell them to use it every day. At least twice a day, 30 seconds application. It's right on the sheet, I'll tell you too. And it's so simple to use, and patients really get into that. They love to use it at home, they really do. It's an incredible tool. You all should be promoting this in your office. Now, you want to know how to promote it? Well, you've got that sheet I showed you. Number 2, I've got a nice PowerPoint that I'll give you. I'll send it to you, and they have it here too, that you can show it on an endless loop right in your office. This part of what I just showed you right now, I have a lay lecture on Mighty Mini, on microcurrent. You can show it right in your office, and every time they'll come into your treatment room, say, where do I get that? How do I get that? I want to send it to a friend, family member, whatever. Yes? Does somebody have a question? Okay, now, here's what I want to show you with the time that we have left. Any questions at all? This is understandable. Utilize, that's the thing I want to point out. When you find and correlate the lymphatic, or for example, colon, don't forget to use your candidiasis solution booklet. Does everybody know what that is? Have you seen it? Yes, those booklets. There, you've got to utilize those booklets. So you're literally now assessing and finding the point, treating the point, and sending them home with the right booklets too. Those booklets are invaluable to the information they give them. Now, speaking of tools, Jamie, I might need your help on this. I don't know. I'm going to try to stick this DVD in here. How do I get it to show? Or Candace or someone? I'm going to show you a DVD that we've developed called the CDO system. And it's a way to assess, it's a way to actually, it's a system that we decided to put together that would help you as the doctor have multiple ways to treat your patient with a Mighty Mini and then be able to correlate it again with the Nutritional Frontier Protocol. And this disc, the CD DVD is, you can get from Jamie from Frontiers here. It's newly created. You all are the first getting a hold of this. It's going to be an invaluable educational tool. Thank you. And by the way, you can, can I give it to you? Here's the number here you can stick in there. Right there, 4026, you can read it. You can, and I highly advise you promote this to your patients that they have one at home. Because if they have a Mighty Mini at home, they need one of these CDO system tools. And it's an incredible, invaluable, the doctor that developed the Mighty Mini developed this tool.
Maybe show them the pamphlet.
On your handout, Oh, the pamphlet, excuse me. So you want to be utilizing the candidiasis solutions booklets. Here's blood sugar. At the same time that you're working with them with candidiasis, you're going to make sure they're following this, okay? Thyroid that Dr. Streeter is going to be speaking of today. This is an invaluable booklet for them, for Iodine Plus and all that we use for protocol. And last but not least, again with GI solutions, as a result of them being on the Candidas program, this is going to be a secondary that we're going to be doing with them as well, okay?